We're back, dear viewers, with our second guest, Dr. Hind Almazeedi, a consultant family doctor and head of the Preventions Programs Unit at the Child Protection Office in the Ministry of Health. Today, she's here to talk about her unit's biggest gift to children in the state of Kuwait, the DAIM Parenting Program. DAIM stands for Continuous Positive Support in Arabic, dear viewers. It is an evidence-based program based on scientific research with the main goal of helping parents gain positive parenting skills in order to have a healthy, safe attachment with their children, to raise them without using harsh discipline or violence, and to have better health for everyone. So, dear viewers, let's all welcome Dr. Hind Almazeedi. Good morning, doctor.
Good morning. Thank you for having me today, and I hope our interview today is beneficial for everyone and our viewers.
Definitely, it will be, and it's a pleasure to have you here, doctor. And would you please explain all about the prevention program?
Yes, so thank you. That's a very good question. The Prevention Programs Unit at the Child Protection Office is one of the units. Of course, the Child Protection Office has many units concerned with the protection of children in Kuwait. And the Prevention Programs Unit's idea is that we want to prevent any violence or harm coming to children. We don't want to act once it happens. We want to prevent it from happening. And that was the idea of creating the Prevention Programs Unit.
All right.
Its goals are basically prevention. We're focused on prevention.
All right. So this happens before having children?
Yeah. Well, actually, prevention can happen even before having children, and when you have children and you don't know the parenting skills needed to parent, for example, a child between the ages of 2 to 9. So parenting is a science, and the program that you spoke about, which is the DAIM program,
yes,
is an evidence-based program that helps parents gain these skills that have been studied, and they help them parent their children in a healthy way that doesn't resort to, for example, screaming or hitting or harming the child emotionally or physically. And that was the idea of preventing that kind of harm by enabling and empowering parents.
All right, so doctor, we're going to talk more about this DAIM program. Off air, you told me the name in Arabic. Would you mention that, please? And
yes,
would you tell us more about the goals of this program?
Okay, great. So the DAIM program, it's a very interesting term. It actually comes from the Arabic abbreviation دعم إيجابي مستمر. So spells out DAIM.
All right.
And the idea is that we want to give support, continuous support for parents. And that's how we came up with the name. So it's the local name of an international program called Parenting for Lifelong Health. That's the program that we adapted the DAIM program from at the prevention units in the Child Protection Office in the Ministry of Health. And we were very happy to get the support of the Minister of Health and the ministry and a lot of other government sectors that really helped us, helped fund the program and the training of the trainers in order for us to create the program and adapt it and translate it to Kuwait's context. And the program's goals is basically a few things. Number one, as we previously spoke,
yes,
teaching parents positive parenting skills. And number two is related to this, and it improves, is that it aims to improve the behavior of children. And number three, it helps the mental health of the parents. So we know that parenting is very stressful. It can be very stressful for parents to take care of children, especially for children between the ages of 2 to 9. So the program aims to help parents learn how to do self-care and to take care of themselves in order to have less stress. And number four, which is the most important, it decreases the levels of harsh discipline and the use of physical and physical punishment with children.
All right, that's a really long, intensive program for parents. So your target audience as parents, how do they approach you, or do you approach these parents?
So basically, the parents who are following us on social media, we announce the registration on social media. So the program is absolutely free of cost, and anyone can sign up. They can go into our Instagram account and they can just sign up, but they have to be parents of children between the ages of 2 to 9. Why? Because that age group is the most vulnerable in Kuwait.
Okay.
So that's why we decided to start with a program for parents of children that age. So they can just sign up and they can attend it's 8 modules over 8 weeks. So it's a weekly lecture, 2-hour lecture, and they attend the 8 modules and then they can gain skills, practical skills, and they can practice the skills in these lectures that we present to parents.
All right.
And the DIAM trainers,
Yes.
as you mentioned, we were trained by the international organization, Parenting for Lifelong Health. So we've all been trained by them, and we know how to implement the curriculum in Kuwait in Arabic.
All right. So Dr. Hind Almazeedi, would you cover more topics of this DIAM program? Like, does it involve, as you said, ages from 2 to 9? Does it involve taking their iPad away or something?
Well, I mean, if that's a parental goal that you want, for example, to decrease screen time, then you can actually go into the program and learn how to implement that at home. Of course, screen time is a big issue for parents, you know, everywhere, not just in Kuwait. So the topics that are covered by the DIAM program are basically, number one, how to spend one-on-one quality time with your child, how to implement that, what to do during that time in order to give the child a feeling of importance. Number two, a module about talking about feelings and expressing feelings, because it's very important for us to identify our feelings and express them in order for our children to learn how to do that and control their feelings. Number three is we want to learn how to give praise to our child, when to give praise to our child. And then number four is how to put household rules and routines in order to have a very consistent schedule that a child knows is, you know, knows what to expect in order for them to follow instructions. And that's the fifth topic, which is how to give positive instructions. And then we have how to deal with challenging behavior using such techniques as consequences. And then we have the module 8, which is problem-solving skills. Because these are skills that we need as well.
Yes.
And parents are going to notice when they join the program that the skills they learn to parent their children are skills that we need in our life as well. So it's very important, I think, for both parents and children to know these skills.
It is important, and as we're moving into the future, I'm sure a lot of things are changing, how to behave or how to praise these children. For example, before, you know, doctor, they used to give us half a KD, now it's like you have to give them an iPhone, right?
Yeah, times are changing, definitely.
Yes, so doctor, as you said, the DIAM is a futuristic program, and it's, as you said off the screen, you provide an application for the parents. Would you mention more about this application?
Well, it was very important for us to utilize technology in our program. We know that a lot of the parents are young and they use their mobile phones, and we wanted the reference to be technological rather than paper. So
Yes.
before, when we used to attend lectures, they give out papers and then we go home and we lose the papers. But then we thought of creating the app with the organization that created the curriculum, and we created the DIAM app, which parents download and they can use as a reference as they attend the lectures. So if they forget something from the lectures, they can always go back to their phone and review and actually practice the skills that they learned in the lecture by using the app. So it's amazing, you know, that we were able to incorporate technology into this program in order for us to, like you said, implement a futuristic technique.
Yes, this is really great for parents these days. And since you said, is this the first course that happened, and what are the feedbacks that you got from parents?
That's a good question. So yes, our first course that we implemented was in April and May and June. So it was 8 weeks over those 3 months in 2025. And I think I was personally very happy as the director of the program, of this program, DIAM program, to know that the parents, before they entered, they were saying that they had goals that they wanted to achieve. After they finished the program, we had a survey to ask them whether they achieved those goals. And we were surprised to know that many of them achieved the goals, and they really felt that the program was beneficial, that their children's behavior got better, and the quality of their life became better. And I thought that was amazing, that I could actually see the benefit of the program happening live right in front of me as we were training the parents.
Wow.
So I was so happy, that the first cycle, the first course that we presented to parents was such a success, and the parents were so happy, and they were saying that they would recommend this to other parents.
That's very nice to hear from you, doctor, about this research that you have. So talking about research and this program, how do you see it changing in the future? Like, for example, Kuwait's vision of 2035 in healthcare. How does it, is it involved? Is it involved in this vision?
Well, actually, it is very much involved, because Kuwait's vision includes a lot about health and about training of human resources, about empowering people, you know, that giving them skills and knowledge and training, and that's one of the main goals of the DIAM program. And I think that's why we were so happy, because it aligned with Kuwait's vision. And then you asked the question about the research that we're doing. So yes, in order for us to know whether the program is working or not, we can't just do a program and just, you know, guess that it's working. So we had a research project alongside the program that was assessing the effectiveness of the program scientifically to know, is it working, is it not? And it turned out to be working. Nice. Alhamdulillah, that was good. And then we also are using the research and the data from the research to improve the program, because it's not a static program. We can always improve and focus on the points that the parents are saying that is important to them. And in the future, like you said, we hope to have a collaboration with all GCC countries, because parenting is something that's important to all parents everywhere. And because our cultural similarities between the Gulf countries exist, we hope in the future to collaborate with other Gulf countries, such as, for example, the Emirat. They've already reached out to us and they want to have collaborations with us. Wow. And we hope to have that as a GCC collaboration, for example, between the health councils. And maybe create a GCC project that focuses on parenting for lifelong health.
Inshallah, Doctor, maybe you can see all the GCC countries collaborating with your DIAM program, and especially, mashallah, dear viewers, Dr. Hind Almazeedi is the director of this program. So, Doctor, how would parents reach out to you, and how can they register in this program?
Yes, so parents can register. They can just visit our Instagram account, which is @KNCPP. And then they'll see in the bio the link for the registration, and they can register for free. Our next cycle is happening on October 25th. It starts October 25th running until December 13th. So it's 8 weeks, like the one before it. And our trainers are all going to be there. You're going to meet them, the DIAM trainers. They're amazing, amazing set of people. They're very dedicated, and we're all you know, there, and we're very passionate about this. And the parents who want to sign up, they can just register, and they're going to attend the program, hopefully, and benefit from it.
Inshallah, Doctor. So, Doctor, would love to ask you, do you have any final message for our dear viewers today?
Well, my final message is that I want all parents to know that we're here to help you. We're here to empower you. There are a lot of, parenting is a science, and there's a lot of research out there helping parents how to parent in a healthy way. And this is what we're here. We're here to give them that and to empower them with these skills. And I would like to thank you and KTV2, of course, for having me today so we can talk about this important topic. Thank you so much.
You're most welcome, Doctor. It's such a pleasure to have you here on Good Morning Kuwait and explaining all these insightful information for our dear viewers. So, dear viewers, we'd all like to thank our guest for today, Dr. Hind Almazeedi, a consultant family doctor and head of prevention programs unit at the Child Protection Office in the Ministry of Health. Thank you so much.
Thank you.
So, dear viewers, now we shall take a quick break and we'll be right back. Stay tuned.